Hello, everyone, and welcome to today's session. And today we'll be discussing the theory related to the chapter Reproductive Health. So today we will discuss the theory focusing on the NEET exam. So in this session, I will tell you which topics are very important, which topics, questions from which topic can come from in the NEET exam. Okay, so we'll talk about the NCERT section 3.1 and 3.2 here, and we'll be discussing the theory related to this chapter focusing on the NEET exam. This is the part 1 of the lecture. So we'll cover some of the topics in this session, and rest of the topics we'll cover in the next session. Before starting this lecture, I just want to give you one information that the images, text, and other materials used in the presentations are for education purposes only. We respect the intellectual property rights of the original creators and owners. If you are the owner and have any concerns or issues, please contact us at sathee@itk.ac.in and we shall remove the content immediately. Please note that parts of the content may have been generated using generative AI, which is experimental. What are the objectives of today's session? So first, we'll discuss reproductive health problem and strategies. So we will understand this topic on the NEET level, exam level. So within this, we'll talk about the reproductive health. How can you define reproductive health? And we will understand various dimensions which are included under the reproductive health, okay, which are physical, emotional, social, and medical aspects. Then we'll understand the major reproductive health problems in India and understand the government initiatives implemented to address these issues. Then we'll discuss the topic population explosion and birth control. Within this topic, we'll talk about the population explosion. We will analyze the reasons for the population explosion, causes, and the consequences of population explosion. Then we'll understand the different birth control methods. Okay, we'll talk about the contraceptive methods and we will evaluate their effectiveness, advantages, as well as the limitations in the family planning. Okay, so first of all, we will discuss the trend analysis for the NEET exam. So within this, I will tell you which topics are very important for the NEET exam and from which topics the questions have come in the previous NEET examination. Okay, we'll be talking about the topic reproductive health problem and strategies. We'll talk about this topic population explosion and birth control also. So here you can see now, this is very important. So weightage of this chapter is 2%. So out of the total chapters, weightage of this chapter is 2%. And you get 1 to 2 questions every year from this chapter. And from 2018 to 2024, 14 questions have come from this chapter. Here you can see even if 1 or 2 questions are coming from this chapter, then this chapter is obviously very important. Okay. Now here you can see in this table what is given to you: the year, the topic name, concept used, number of questions, and difficulty level of the questions. So in 2018, the questions came from the topic reproductive health and population explosion. Within this topic, the question came from the concept birth control methods. So one question came from this topic and the question was of average type. Then you can see the questions are basically coming from which topic? Reproductive health. Okay. Then population explosion and birth control. Again in 2000, you can say 24 questions have come from birth control. 2023 also birth control. 2022 also birth control. 2021 also birth control. So birth control topic is very important. Within this, you will study the contraceptive methods. The questions are coming from the contraceptive methods. So there are various category of contraceptive methods. And questions are coming from IUDs, which is one of the category of the contraceptives. Then questions are coming from population stabilization. Questions have also come from the topic medical termination of pregnancy, which is known as induced abortion, sexually transmitted diseases, and infertility as well. Although this topic is not that, you can say, common here, but the topic from which questions have come is birth control. Questions are of average type. Okay. Easy question also came in 2021. Usually the questions are of average type. Maximum number of questions which have come from this chapter is 3. In 2019, 3 questions came from this chapter. And minimum number of questions that can come from this chapter is 1. Okay. So you should prepare this chapter. Okay. So this chapter is very important. You have to prepare all the topics, especially focus on the contraceptive methods. Now let's begin with this lecture. Now, reproductive health, as defined by World Health Organization, is the overall health or total well-being of the person. And it includes or it covers physical, emotional, behavioral, and social well-being of the person. So all these aspects are included under the reproductive health. Now, reproductive health includes, first of all, physical health. Okay, so when we talk about physical health, we mean healthy reproductive organs. That the reproductive organs are healthy, they are producing viable gametes. Okay, then the reproductive organs, they are producing the hormones. So one of the role of reproductive organs is to produce hormones as well. Another role is to produce the gametes. So reproductive organs are healthy, they are producing gametes, they are producing hormones. Okay. Then emotional. The person should be emotionally stable. So within this come the mental health and the positive sexual relationship. So when the couples, they are in a relationship, they are emotionally attached to each other. The person should be emotionally stable as well. Then behavioral well-being. So within this is included safe sex practices and responsible choices. Okay. So safe sexual practices means avoid multiple partners, use contraceptives. Then social well-being. Within this is included healthcare access and supportive environment. So reproductive health includes all these aspects. Okay. Now, some of the strategies that can be adopted to achieve total reproductive health are. So again, this is very important. Question can come from here in the exam. What are some of the strategies? So first of all, government launched family planning program in 1951. Okay, you should remember the year also. And there was another program, reproductive and child healthcare program. This was launched in India on October 15, 1997. Again, you should remember the date as well. So these two initiatives, these are very important, family planning and reproductive and child healthcare program. Now, government and NGOs also, they work to create awareness about population control and social issues like sex abuse and the crimes. So first of all, government has launched these initiatives like family planning and RCH, and the government as well as the non-governmental organization, they're also creating awareness about the population control, how the population can be controlled. They are spreading awareness regarding the various contraceptive methods. They are spreading awareness regarding the, you can say, population explosion is happening. So it can, what are the consequences of population explosion? The awareness is being spread regarding the consequences of population explosion also, because resources are limited. If there is a rapid increase in the population, then it will not be easy to even get the basic resources as well. And awareness should be created regarding issues like sex abuse and sex crimes as well. Okay. This will also help to achieve the total reproductive health, or this will also achieve this will also help in achieving the reproductively healthy society also. So here you can see this is a slogan. A small family is a happy family. So government is promoting the family planning. Family planning can be done using the contraceptive methods. Okay. The government is also giving monetary help for the couples who are going for small families. So all these initiatives are very important to achieve the reproductive health. So sex education should be introduced in the schools. Okay. So introduction of sex education in schools and colleges provide right information to the youth. So youth, okay, or the individuals within the age of 15 to 24, these are quite, you can say, vulnerable, or they are at very high risk. Okay, they are of high risk of getting these STDs as well. And the individuals in this age, 15 to 24, they are very curious. They want to explore new things. Okay, and there are a lot of changes going on in their body as well. So in the adolescence phase, what is happening? There are a lot of morphological and physiological changes in both males and the females. So they are curious about their body as well. They want to explore new things as well. So they should be made aware of the changes that are happening in their body. Okay, like there is a start of menstrual cycle in the females. Okay, development of mammary glands in the female. So there are a lot of morphological changes. Even in males also, appearance of facial hair, pubic hairs. Awareness regarding the sex-related issues or reproduction-related issues should also be spread, and sex education should be provided in schools and colleges. Okay, sex education helps eliminate myths and misconception about sex-related issues. So there are a lot of myths and misconception about sex-related issues. So this sex education will help dispel these myths regarding the reproduction-related issues. Information about birth control means information regarding the contraceptive methods, pregnancy care, breastfeeding, and gender equality should be provided to the couples. Okay. So information about birth control means, okay, so the couples should be informed by the professionals, medical professionals, that which contraceptive method will be effective for them. Okay, or how they can do the family planning. The proper guidance should be given to them. Then information regarding pregnancy care. So this involves the care of the mother. Okay. So this comes under prenatal care. Okay. Care of the mother should be taken because mother is under a lot of stress. And the mother has to feed herself and the mother has to feed the growing fetus also. So the proper care of the mother, proper nutrition should be given to the mother. Okay. Then importance of breastfeeding. Awareness should also be spread regarding importance of breastfeeding because mother's milk is very nutritious. It consists of a lot of vitamins as well, like vitamin A, vitamin B12, vitamin K as well. And it has antibodies also like immunoglobulin A, which provide resistance in the newborn. Then information should be spread regarding gender equality, that both males and females, they are equal. So what do the couples do? They go for prenatal sex determination. And if they find out that the child is a female, then they abort that child. So this is known as female feticide. The information should be spread regarding the gender equality also, that both males and females, they are equal. So there should be mandatory sex education in the schools, and so schools needs sex education. Now there should be better infrastructural facilities and material support as well. So our infrastructure, our healthcare system should be good. And what comes under the material support? The vaccines, the contraceptive pills, okay, the contraceptive devices. These should be easily available. So medical assistance must be provided regarding the reproductive health issues, including the pregnancy. Okay. Then STDs, how to prevent STDs. Okay. Then abortions. Yeah, so abortions, can be very dangerous if they are done, you can say after 12 weeks. So till 12 weeks, they are quite safe. But after 12 weeks, the abortions can be quite risky. So awareness should be spread regarding the abortions also, as well as guidance should be given regarding the infertility in the couples as well, and how these infertile couples, they can bear the child. Information regarding this also can be given, or how to cure infertility. Sometimes infertility can be cured as well. Okay. Now, new techniques and strategies needed to be improved healthcare delivery. So new strategies and new techniques should be implemented to improve the healthcare facilities. And new techniques should be implemented to improve the healthcare delivery, means delivery of the child as well. Now, reproductive health means properly functioning reproductive organs. So this we already know. This is a very basic definition of reproductive health. Properly functioning reproductive organs, although reproductive health includes the social, emotional, behavioral, and social well-being of the person. Now let's discuss about a technique known as amniocentesis. Amniocentesis is a test to determine the fetal sex or to determine the gender of the fetus. And it's also used to determine the genetic disorders. So by analyzing the chromosomes in the amniotic fluid, the fetal sex and the genetic disorders in the fetus can be determined. So amniocentesis is a kind of, or it helps in the prenatal sex determination, and it also helps in the detection of the genetic disorders, okay, such as Klinefelter syndrome, Turner syndrome. These are genetic disorders. Yeah. So what happens in amniocentesis? Amniotic fluid is collected, and this amniotic fluid consists of the fetal cells, and within these fetal cells, the chromosomes are analyzed. Yeah. If there is an XY chromosome, that will be male. If there is an XX chromosome, that will develop into female. Amniocentesis is used to detect genetic disorders also, like Down syndrome, hemophilia, sickle cell anemia as well. And it is also used to assess the fetal survival as well, whether the fetus will survive or not. So you can see this is the procedure of amniocentesis. Here, through the needle, the amniotic fluid is collected, and then amniotic fluid is taken in the test tube, and then the fetal cells within this amniotic fluid is analyzed. Now, amniocentesis is legally banned now because there was misuse of amniocentesis. The amniocentesis were being used for prenatal sex determination. So it is banned now, and it is banned to avoid the female feticide. So again, question can come from here. Why the amniocentesis have been banned? Or what are the uses of amniocentesis? And why it is being banned now? Because there are increase in the cases of female feticide. Okay. So to avoid the female feticide, amniocentesis is being banned. Now, SATHEE-MED, this is an oral contraceptive for the females. This was developed by scientists in the CDRI Lucknow. So we'll talk about this also when we talk about the barrier methods. Okay. So here you can see this is the procedure of amniocentesis. We have discussed this. Now let's discuss the reasons for the population explosion. Why the population explosion is happening? What are the cause of the population explosion, and how we can control the population explosion. Earlier we were talking about the ways to achieve the reproductive health. What are the reasons of population explosion now? The first one is the rapid decline in the death rate. Okay. So there is a decrease in the maternal mortality rate. Maternal means mother. So there is a decrease in the MMR, maternal mortality rate. Now what is maternal mortality rate? It is the number of maternal deaths per 100,000 live birth during a given time period. So there is a decrease in MMR. Then there is a decrease in infant mortality rate also. IMR. What is infant mortality rate? Number of deaths of infants under 1 year, 1 year old per 1,000 live births. This is infant mortality rate. Or simply you can say maternal mortality rate is death of the mother. Infant mortality rate is the death of the infant. So our lifestyle has improved. There are better healthcare facilities. The infrastructure is good. The medical facilities are quite good now. So that's why there is a reduction in the death rate. So this is one of the reasons of the population expansion. Less people are dying. And there is increase in the birth rate also. So again, medical facilities are better. Okay, the fetus or the newborn, that is quite healthy. And there is less infant mortality rate also. Third one is increase in number of people in the reproductive age. Okay, so if the individuals, they are in the reproductive age, then they can produce the progenies. They are capable of producing offerings. They are capable of producing children. The more the number of people in reproductive age, more will be the population, because they will reproduce and they will produce children. So these are the reasons for the population explosion. Okay. Now, what are the steps to control population explosion? Now, people should be educated about the advantage of the smaller families. So awareness should be spread regarding the family planning, and awareness should be spread regarding the importance of smaller families. Then second one is statutory raising the marriageable age of males to 21 and females to 18 years. So this has also led to decrease in the population size. When the couples, they are in the marriageable age, okay, then they will marry and they will produce children. If they are not in the marriageable age, or if the marriageable age has been raised, then there are less chances that children will be produced. Now, couples of reproductive age are motivated through family planning by adopting birth control measures. Awareness should be spread regarding the birth control measures. Okay, and these birth control measures can help in family planning. The government is promoting the couples Government is even providing incentive to the couples to go for family planning. Now let's talk about the birth control now. Under this, we'll talk about the various contraceptive methods. Now, regulation of conception by preventive methods to limit offerings is called birth control or the contraception. Clear? So here we are limiting the offerings. We are limiting the, you can say offerings or you can say children's. Okay, this is known as birth control or contraception. We are using some preventive measures. Okay, these preventive measures, they are contraceptive methods. Now, they basically prevent the fertilization. So all these birth control methods, ultimately, they will prevent the fertilization. Fertilization means fusion of the male and the female gametes. So if there is no fertilization, no zygote will be formed and no embryo will be formed and no individual will be formed. Now, what are the characteristic features of the contraceptive? So a contraceptive should be user-friendly. It should be easily available. It should be quite effective. And it should be reversible with no or least side effects. So what do you mean by the contraceptive devices should be or methods? They should be reversible. The reversible means that if any person or if female or male, if they stop using these contraceptive methods, then they can again conceive. Then the female can again conceive. So these contraceptive methods should be reversible. Means when the individual is using the contraceptive method, then there will be no pregnancy in the females. And if they remove these contraceptive methods or devices, then the female can again conceive. Now, these contraceptive devices should not interfere with sexual desire and sexual act as well. Now, let's discuss the various categories of the contraceptive methods or various categories of the birth control methods. First one is the natural or the traditional methods. Second one is the barrier methods. Third one is the chemical methods. Fourth one is IUDs, also known as intrauterine devices. Then fifth is oral contraceptive methods, injectable, and the implants. So we'll talk about all of these 7 categories of the birth control. Okay, so there is another category also, surgical methods, that are permanent methods, also known as terminal methods. So surgical methods, they are permanent methods, or terminal methods. We'll discuss why they are known as terminal or permanent methods as well. Okay, simply they are non-reversible. Rest of the methods, they are reversible. Surgical methods, they are non-reversible. First of all, let's talk about the natural methods now. Okay, this is the first category of the contraceptive method, natural. Now, natural method works on the principle of avoiding chances of ovum and sperm meeting. The ovum and the sperm, the female gamete and the male gamete respectively, they are not, you can say, allowed to meet. If they do not meet, there will be no fertilization. There will be no embryo formation. So this includes option number A is periodic abstinence. Okay. Now the couples, they avoid sex for days 10 to 17 of cycle as it's the fertile period. So day 10 to day 17 is the fertile period. So couples, they avoid having sexual intercourse or coitus during day 10 to day 17 where the chances of ovulations are very high. Okay. So this period from 10 to 17 is known as the fertile period. The next one is withdrawal or the coitus interruptus. So now the male partner withdraws the penis from vagina just for ejaculation to avoid the insemination. What is insemination? Transfer of the sperms into the female genital tract. Clear? Withdrawal or coitus interruptus. Okay, so if the male withdraws the penis, then what will happen? No semen will be released in the vagina. So there will be no insemination. Okay, now let's continue the natural method. So the third one is lactational amenorrhea. So what happens during intense lactation? Means during breastfeeding, there is no ovulation. There is no menstrual cycle for 6 months. So remember this. The question can come from here. This lactation amenorrhea, this is what kind of method? So this is a natural method. Okay, and during this, what happens? During intense lactation, there is no menstrual cycle. The egg is not released, so there is no ovulation. And this method, this is effective up to 6 months of the pregnancy. The next one, as no medicines or devices are used in these methods, side effects are almost nil. So here you can see no drugs, no chemical, no medicine, no hormone is being used. So its side effects are almost nil. But the chances of failure are high. Okay, so chances of failure though of these methods are very high. Okay, because you are making the assumptions in the natural methods. Clear? Okay, there will be no menstrual cycle till 6 months. So the couples, they can enjoy this sexual intercourse till 6 months. Okay, so this is not quite definitive. This is not quite accurate. Now, next one is the barrier methods. So under this barrier methods comes the condoms. In barrier methods, ovum and sperms are prevented from physically meeting with the help of the barriers. Ovum and sperm, they are gametes, female and the male gametes respectively. They are prevented to physically meet each other. Okay, so these methods are available for both males and the females. Condoms, they are known as the barriers, and they are made up of thin rubber or latex. A male condom, they cover the penis, and the female condom, they covers the cervix or the vagina during the intercourse or during the coitus. Okay, so there is this condom, they prevent the insemination also, because they are covering the penis. Okay, they are covering the vagina and the cervix. So there will be no transfer of the sperms. There will be no transfer of the semen into the female genital tract. And these condoms, they prevent the spread of STDs also, because STDs, they spread through body fluids, such as semen and vaginal secretions. The use of condoms also prevent the STDs. So here you can see in figure 3.1, this is condom for male, figure 3.1. B, this is condom for the females. Now, Nirod is a popular male condom brand. These condoms, they protect from STI also. And one of the STI is AIDS. AIDS is highly dangerous sexually transmitted diseases. The condom also protect from the STIs, because STIs, they are spread through sexual intercourse. Male and female condoms are disposable and they are self-inserted, means they are quite user-friendly, they are easily available. Diaphragm, cervical caps, and vaults are rubber barriers for female reproductive tract. Where you can see again in this figure, these are the condoms for the male, and in 3.1b, they are showing you the condoms for the female. Next one, third is the chemical methods. So these chemical methods, they're used along with the barrier methods. So they are used along with the condoms and the diaphragms, which come under the barrier methods. Okay, so these chemicals, they kill or they inactivate the sperms. They increase the contraceptive effectiveness as well. They are available as cream, jellies, and foam. So these chemical methods, these are available as creams, jellies, and foams. And these creams, jellies, and foams, they are spermicidal. They kill the sperms. And thereby they enhance the contraceptive effectiveness or contraceptive efficiency. So the contraceptive should be quite efficient in preventing the pregnancy. Now, these chemical methods must be applied before the sexual intercourse. So intrauterine devices. Next one is the intrauterine devices. So these devices are inserted through the uterus, and these devices increase the sperm phagocytosis. So see, question can come from here. How this intrauterine devices work? How the chemical methods work? The questions can come from here. So these IUDs, they are of the following types. First one is the non-medicated IUDs. So this non-medicated IUDs, they doesn't consist of any hormone or medicines. Example is lipus loop. So lipus loop is a thin plastic. It is a thin plastic wire bent in S shape. Clear? That straightens during the insertion because these IUDs, they are inserted into the uterus and then they regain their shape inside the uterus. So lipus loop is example of non-medicated IUDs. Question can come from here. Then next one is hormone-releasing IUDs. Some of the IUDs, they release hormones also, such as progesterone. And they prevent the sperm entry and they affect the uterus as well. Yeah. So these hormone-releasing IUDs, how do they work? These IUDs, they prevent the ovulation. Okay. They make the cervix hostile. Okay. So they cause the inflammation of the cervix and they block the entry of the sperms. So what happens? How do sperm travel and reach the fallopian tube? So sperm will enter through vagina. Then from the vagina, it will pass the cervical canal. It will reach the cervix. And from the cervix, it will reach the uterus. And from the uterus, sperm will enter into the fallopian tube. And in the ampulla region of the fallopian tube, the fertilization occurs. So this is how the hormone-releasing contraceptive methods are used. Okay. Next one is copper-releasing IUDs. So they release copper ions. And these copper ions suppress the sperm motility and they prevent the fertilization. Examples are copper T, copper 7 multi-load 375. Here you can see in this image, this is copper T. Now next one is oral contraceptive pills. So this pill contains hormones such as progesterone or progesterone estrogen combinations. And these are taken as the tablets. These pills consist of the hormones. So wherever hormones are involved, how will they prevent the conception? How will they prevent the pregnancy? So they will inhibit the ovulation. They will make cervix hostile. Okay. And then they will prevent the implantation also. Clear? Now these oral contraceptive pills, they have to be taken daily for 21 days from the start of the menstrual cycle. So continuously, the females have to take these pills, okay, for 21 days straight. Then a 7-day gap is given. Okay, so repeat after 7-day gap when menstruation occurs. So after 21 days, 7-day gap is given. The total is 28 days now. 21 days plus 7 days is 28 days. Clear? And then after 7 days, again the females start taking these pills. These hormonal pills, they prevent ovulation and implantation, and they alter the cervical mucus. So what do you mean by alter the cervical mucus? Means they make cervix hostile. They cause the inflammation of the cervical region. So the sperms are blocked. They are not able to move forward and reach the fallopian tube because they are blocked here, because the cervix becomes inflamed now. There's inflammation in the cervix. Now these pills are very effective with the minimum side effects. SATHEE, a new contraceptive for the females, it contains a non-steroidal preparation, means it doesn't consist of the steroids. Okay, so this estrogen and progesterone, these are steroid hormones. But SATHEE, this is non-steroidal. Okay, that's why it is quite safe. So usually the steroids have a lot of side effects, but here it is non-steroidal preparation. And then it is a once a week pill with very few side effects and high contraceptive value. So females have to take this pill only once a week. Okay, clear? So this SATHEE will have minimum side effects because first of all, it is non-steroidal and it is non-hormonal as well. Now, sixth one is injectable contraceptives. So under this comes the injections, which consist of the hormones. So these are given via or with the help of needles, and they are directly injected into the body. Some of the chemicals, or you can say the hormones, they are directly injected into the body. Why they are directly injected into the body? Because then the effectiveness increases. The effectiveness of this contraceptive increases. This provides immediate absorption of the contraceptive method. Now it is quick therapeutic effect. It has a very quick therapeutic effect because you are directly injecting the hormones into the blood. So that way it has a quick therapeutic effect. Okay, now the seventh one is implant. Surgically inserted devices. So what are implants? Implant, they are surgically inserted devices. So these devices are inserted within the skin of the shoulder. Okay. So they are long-term drug or hormone delivery. So implants, what they do? Implant this slowly, they release the hormones in very small quantities. So they are continuously releasing the hormones in small quantities. So that's why they have a long-term effect as well. So they are placed inside the body, they are placed inside the skin, and they have sustained treatment effect. So they work for a longer time period. And you can see here the image of the implant here. Now progestrogens or progesterone, progestogen estrogen combinations or IUDs within 72 hours of coitus are very effective emergency contraceptive to avoid pregnancy after unprotected intercourse. So these are the emergency contraceptives. What do you mean by emergency contraceptives? So these emergency contraceptives, they help to prevent the pregnancy. They help to prevent the conception in the females. Clear? And these usually consist of the hormones. So these consist of hormonal pills and IUDs. Okay, and these contraceptive methods, these oral pills and these IUDs, they you can say should be used within 72 hours of the coitus. Okay, so this is the time period within which these contraceptive methods should be used. So these contraceptive methods will be effective within 72 hours of the coitus only. If they are taken later, then they can't, or they won't be able to prevent the fertilization. Yeah, that's why the 72 hours is underlined here. Okay, the next one is the surgical method, also known as sterilization. Sterilization process in males is known as vasectomy. Question has come from here in NEET 2023. In this process, small part of the vas deferens is removed or tied up through small incisions on the scrotum. So what do the surgical methods do? They prevent the transport of the gamete. So again, question can come from here. How do surgical methods work? So they prevent the gamete transport, because this vas deferens, this is what? This is accessory ducts in the male. What were the accessory ducts in the males? So these were retitestis, epididymis, vas efferentia, vas deferens. So if the vas deferens is blocked, the gamete transfer is blocked. Okay, so here the part of the vas deferens is cut and tied. This blocks the transport of the sperm. So here you can see in the figure 3.4a, vasectomy is being done. So here vas deferens is cut and tied. Next one is the tubectomy, which is done in the females. So what happens in tubectomy? A section of the fallopian tube is removed or tied through a small cut in the abdomen or the vagina. So again, fallopian tube is the part of the female reproductive organ, and fallopian tube, they are the accessory ducts in the female. Accessory ducts help in the transport of the gamete. So again, here the transport of the egg is blocked. Okay, because what happens? The ovary, the egg which is released by the ovary, they are collected by the fimbriae of the, which are present in the infundibular region of the fallopian tube. Then from the infundibulum, the egg reaches the ampulla where fertilization occurs. So here the section of fallopian tube is removed or tied through a small cut in the abdomen or the vagina. Here you can see in the figure 3.4, they are showing you the tubectomy. So there are two ovaries, so there will be two fallopian tubes. Okay, so let's discuss some tips and tricks for the NEET exam. Okay, related to this chapter, reproductive health. So this topic is very important: birth control and contraceptive methods. Okay, so you should know about the various category of contraceptive methods. First one is natural. Under this, you should know about the periodic abstinence. Okay, so the couples, they abstain from coitus during days 10 to 17th of the menstrual cycle. So this is the fertile period. Day 10 to day 17 is known as the fertile period because egg is released. So there are chances that egg is present at this time in the fallopian tube because egg is released during the mid of the menstrual cycle, which is around 14th day. So the couple should avoid having sexual intercourse during days 10 to day 17 of the menstrual cycle. Then withdrawal of coitus method. So the males withdraw the penis before the insemination. And then lactational amenorrhea. Question can come from lactation amenorrhea also. So there is no ovulation, there is no menstrual cycle. Okay, during intense lactation. Next one, barrier methods. Under this is included the condoms. So they prevent, these barrier methods, they prevent meeting of ovum and the sperm. Condoms, they are made up of rubber and latex. They are disposable. Both male and female condoms are available. And it won't allow semen to enter into the female genital tract. And diaphragm, cervical caps and walls, these are female condoms. They cover the cervix and the vagina. Then third one is the chemical method. Under this comes the spermicidal jellies and foams. these chemical methods, they increase the effectiveness of the barrier methods. Okay, they increase the effectiveness of the contraceptive methods. So they can be used along with the condoms as well. IUDs, they are known as intrauterine devices. So there are 3 types of IUDs, non-medicated IUDs, under which is included lipase loop, which is a plastic. It is made up of plastic, and these IUDs, basically what they do, they increase the phagocytosis of the sperms in the uterus. Then there are copper releasing IUDs. Examples, you should remember the examples of copper releasing IUDs and how the copper releasing IUDs function. So they release copper ions which suppress the sperm motility. And they also suppress the fertilization capacity of the sperm. So this is very important. Question can come from here. Then there are hormone releasing IUDs. You should remember the examples of hormone releasing IUD, progesterone, LNG20. Wherever hormone is involved, okay, so what you should remember, wherever the hormone is involved, how they prevent the conception. So they prevent the ovulation, they prevent implantation, and they make the cervix hostile. Okay. Now, this oral pills, so this consists of the hormones as well, such as progesterone or progesterone-estrogen combination. They inhibit the ovulation, they inhibit the implantation, and they alter the quality of the cervical mucus. Means they make the cervix hostile. They don't. So by altering the cervical mucus, what happens? The entry of the sperms is prevented. So these hormonal IUDs and hormonal pills, they work in a similar manner. So alter the quality of cervical mucus means the cervix becomes quite thick. There is inflammation in the cervical region. And SATHEE-MED is a non-steroidal once-a-week pill, and these have very less side effects. Then there are injectables. Injectables also include hormones. Okay, implants also consist of hormones, so they also work similarly to the oral pills and the hormone-releasing IUDs. Then there are sterilization procedure which block the gamete transport. Under this, there are 2 methods: vasectomy, which is done in the males, with a small part of the vas deferens is cut and tied, and then tubectomy, which is done in the females, where the small portion of the fallopian tube is cut and tied. Okay, so this was the end of this session. So today we discussed this topic, reproductive health, focusing on the NEET exam. All right. So we'll meet you in the next session. I hope this session was quite knowledgeable for you. Thank you very much for listening.